Okay, so we're going to talk about the cephalosporins now, and you remember the cephalosporins also have that beta-lactam ring, but they have fourth generation. I think this is the fifth generation. Anyway, so thinking about these, they may be comparable to the penicillins and their extended spectrum penicillins, but the first generation basically were for gram-positive cocci, but they didn't work well for MRSA or for some staph. And so an example here that was used was cefazolin, which is Ancef, and these are mostly focusing on gram-positive cocci. The second generation, an example is cefoxitin, and these have increased action against gram-negative and also gram-positive rods, focusing on enteric bacteria. So moving on to becoming a little bit more gram-negative, and then the third generation is becoming even more gram-negative and focusing on examples, for example, Pseudomonas aeruginosa, Haemophilus influenza, but then they are less active against gram-positive bugs than the first generation, so the first generation may be better if you have gram-positive. So an example here is ceftriaxone and ceftazidime, and so you could remember that these are anti-pseudomonal. So the fourth generation is also going to be good for Pseudomonas, Streptococci, and MRSA. And these are, you could think of these as being broad spectrum, covering both gram-positive and gram-negative.